during cementing or final reduction. In cement, we are cutting through the steps and other irregularities from being inadvertently when you do a base where damage the ligament, or more often I have seen that during final reduction. If your medial side was slightly tight and you try to reduce it in the right and you cause damage. And here is one patient that I saw. What do you do if you get an imbalance in a component like this? If it is a one-piece component or if it is a all-piece, you cement it in, and now you know that there is an imbalance. Now this patient,
that the post jumped and it was dislocating. This is how this patient came to me, and she was like this for a long time, and she just couldn't afford any surgery. But I think this is what it is. If you have a one-piece component and you recognize after releasing tourniquet that you are loose, then I think the only choice is to revise that tibial component completely and put a modular one where you can increase the size of the poly. Now, if the damage during cementing or final reduction occurs, it can occur at two places. One is to the insertion of the avulsion, medial epicondyle, such as in this patient. This was a case done by me way back in 1999. The right side was the one which was damaged. Here you can see this is a LCS type mobile bearing knee, and this mobile bearing knees need to be put in a very tight position because you're worried that this might dislocate. And so I think medial side was tight, and while reduction, I avulsed the medial epicondyle. Most of the time, this epicondyle which avulses is in continuity because of the soft tissue attachment around, and it doesn't really fly off, which happens often on the lateral side but not on the medial side. It is still in continuity, and all I do if that happens after cementing is to put a couple of stitches as shown here, and I take the stitches with a thick Medio needle or ortho strong needle through the bone. Bone is not very strong in that area, and you can actually, or if you need, you can drill through the bone here, but this piece is very easy to negotiate. So that is what was done for this patient, and here she is at 15 years after the surgery. The joint is still stable and functioning well. If I recognize this at the trialing stage, which also can happen that your medial side was tight and medial epicondyle is avulsed slightly, then I tend to put a stitch through the box, because it is very easy. One stitch suffices and it really holds this piece very strongly, which is what was done for this patient. You can barely see that the medial epicondyle on an AP view was lifted off, but you can see the sign here that it was lifted off. This is an X-ray at 3 months. Now, the damage can also occur in the mid-substance. Very rare at this stage, but it can. And here is one patient which came to me, and of course, I don't know what stage the damage occurred, but that was a gross medial collateral damage, and I think Nilen is going to speak on this later, so I'll leave this behind. But this is a recognized complication, very rare, 0.8 to 8% reported in the literature, and I must thank my current fellow, Dr. Ankur Dhiman, for helping me looking at this substantial amount of data that is available on this injury. It leads to valgus instability, suboptimal comfort and function, and high rate of revision or reoperation. Treatment involves just putting a thicker poly if it is minor, or primarily repair along with augmentation, or use a constrained prosthesis, but definitely alter your post-operative protocol. And the results with all of them with thicker poly was satisfactory, and all repair mechanisms, direct repair, screw fixation, augmentation, all have shown a good satisfactory report. I think I'll bypass this technique itself. The constrained prosthesis has shown good outcome at 10 years, but however, it has shown higher failure rate in young and more active patients. So I think the take-home message is that complete your releases prior to cementing. Do not leave it to do anything after the cementing of the component. Try and use one size thinner poly for your pressurization. And if the damage does occur, recognize it. Don't ignore it, and treat it then and then with one of the techniques. And it does lead to satisfactory outcome. Thank you very much.